Hi, I'm Dr. Peters with Peters Wellness, Chiropractic and Massage. In this week's quick video, I want to discuss the topic from the Optimal Health University, and that is psychological stresses on back pain. And really putting that idea of emotional stress tied into some of the body's aches and pains. And one of the little paragraphs right out here, it says, most people spend approximately 1/3 of their time at work. If that time is marked by unhappiness, stress, and frustration, the result can be migraines, depression, anxiety, chronic heartburn, and a host of other physical ills, including back pain. In fact, some studies suggest that poor work satisfaction is the #1 risk factor for back pain. And there's a few studies that are noted in here this week. And when we have new patients come in, we give them a body chart, and it gives instruction like, hey, put an X wherever you're having pain. Some people will just put an X at their neck and maybe their shoulder or their lower back or a knee or an ankle, whatever it is. And then we have people who mark so much on the body chart, it's like you can't even see white space on the paper anymore. It's like, oh my gosh, they have so much going on. And then we go through, in school you learn what's called OPQRST. And it's like, what was the onset? P is what, palliative or provocative. What makes it better? What makes it worse? Q is the quality of the pain. And R, does it radiate? And S is, what is the severity on a 0 to 10 or a 1 to 10 scale? How would you rate it? 10 being the worst pain you've ever had. And T is timing. Is it 10% of the time? Is it 100% of the time? Does it keep you up at night? So there's lots of questions. We get a lot of data from each patient on each symptom, each area. And sometimes people say, well, it starts here and it goes all the way down my back, and then how it affects and travels through the body. And in some of these cases, like the low back might be new, but the heel is chronic, or the wrist is chronic, or the neck is chronic, but now the low back is flared up and they can't even sit at their desk anymore, something like that. And I'm always asking, like, well, what motivated you to give us a call? And some people are like, well, I had surgery on my knee or on my lower back. I did my physical therapy, but I still have a restricted range of motion, or the pain used to come once every 6 months. Now every 3 months I'm having chronic pain, and it's not going away within a week like it used to. Now it's sticking with me for 3-4 weeks, and it's coming more frequently. So they're getting frustrated. They'll say, I'm just at the end of my rope. Okay, now just that saying in itself shows that sometimes the desperation in people of wanting to get help. And we've been doing this 10 weeks. I was telling you, we had 2 weeks of 5 things to do for 5 weeks, and then the second week was 5 things to do for the second 5 weeks. And I've got them listed here. So get your spine checked, okay? So a couple weeks ago we talked about get your spine checked. Stamp out stress is number 2. For the second week, how can you reduce stress in your life? And when we talk about the psychological factors of issues causing low back pain or other pains in your physical body, for some people like, oh, that's ridiculous. Well, there are a lot of studies that show that it's not ridiculous. And if you have a lot of stress at work, either emotional or physical, but mostly, people have low back pain and they say, well, do you have a stand-up desk? Yeah, I sit, I stand, I do different things, but they're still having a lot of this pain. So they're looking for something, they're trying to figure it out. Well, the idea of having all that stress and looking for a way to get rid of that, whether it's communication, whether it's physical exercise, and those are some of the other things you're talking about. Get rid of the over-the-counter medications. And be cautious of taking something to continue to mask the pain. That was our week 3. Dump the over-counter medications. And now the other thing too, with prescribed medications, you're going to want to talk to the doctor who prescribed it. That some of these things that people are on, they need to be weaned off them slowly. So you want to be really cautious with that. And other medications people are on are keeping them alive. So, I don't want to be known as a medicine basher in any way. Medication saves lives. Is it overutilized sometimes? Yes, but maybe people overutilize a lot of things. So just be careful of the over-the-counter. It's easy to pop a few pills every day, and next thing you know, it's been 6 months and you're still taking pills 4 or 5 times a week. Week 4, the idea of getting sleep. Make sure you're getting your sleep. We talked about figure out what works good for you. That'll be week 4. That should be happening. And then getting your nutrition under control, of course, is very, very important, because if you're not eating well, you're not going to have good energy. If you don't have good energy, you're probably going to exercise and stretch and do other things less than what you should because you're tired. And then you're getting sleep, but it's not good quality sleep. So how everything builds up, and imagine how stressful it would be where you get up in the morning, your feet hit the floor, and you're like, oh, my freaking back hurts again. And a lot of times that's what will finally get people to come to the chiropractor. They're like, I'm just so sick of it. And I'm like, well, why did you wait so long? They're like, well, I had injections and I did things and it helped temporarily, and it's just, I'm not where I want to be. And a lot of times they'll say, well, don't take it personally, but I don't believe in chiropractic. And when I was first starting to practice, I was like, well, why are you here? But it was really, they were at the end of their rope, and their mother's cousin's uncle's sister, was helped by a chiropractor or something crazy. And it used to almost be insulting, but now after 14 years, it's like, it's intriguing. I'm like, really? So you don't really believe that what I'm going to do is going to help, but yet you're here for me to help you. And they're like, yeah. And so that in itself, because if you believe something's going to help you, I think there's more of a chance it will help. Like if you think tomorrow's going to be the worst day ever and you start your day, it's probably not going to be the greatest day, that's for sure. And that's where we talked about in week 10 is to have the right attitude. And even if someone doesn't think that I can help them, if they give me a chance to, a lot of times they stand up after the first adjustment and they're like, wow, I can stand up straighter. I can turn my head farther. My shoulder, I can raise my elbow above my shoulder. That's nice. And whether someone believes it or not, it'd be like saying, well, I don't believe in medicine. It's like, what? What do you mean you believe in it? It's not a freaking religion. I don't believe in chiropractic. It's not a religion. And if you change the physiological input into someone's body, you're going to get a different result out. If you put clean fuel into a car, it's going to burn better and it's going to run better. You clog the fuel filter, nothing's going to happen. It doesn't matter how clean the fuel filter, because the fuel filter's clogged and it's not going to get through. So the idea of dealing with the emotional stressors in the 10 weeks that we talked about, week 6, exercise. Number 7, get outside. If you don't think getting outside is going to make you feel better, now granted, when it hits 110, you might want to be limited a little bit, or you might want to stay in the shade or get in the pool. But get outside, get out of the stuffy offices, And if you work outside all the time, maybe get inside and relax a little bit. The other thing, getting your finances under control is going to help you be less stressed. There's so many. I'm in the middle of taking a course online right now about some investment strategies. Why? Because I love coming into the practice and working because I want to be there, not because I have to be there. And getting all these things under control and making sure I'm a good dad. And because if there's something going on in my family, I'm not going to be focused. I'm not going to be 100% there to help my patients. And that's not what I want. I don't want that for anybody else. And, week 9, get spiritual matters figured out. Whether you're religious or whatever it is, get comfortable with yourself, get to know yourself better, and figure it out and enjoy it. Because emotional factors definitely impact people's health. And pick up a copy of this week's Optimal Health University when you come in, or go to the blog, go to the website, it's there. Instagram, we have a connection to it there too. And I don't like to say don't, just be aware that if you are emotionally stressed out, it can cause headaches, it can cause neck pain, it can cause low back pain, which could then cause you not to work as well. If you're not working as well, you're showing up late, or you're showing up tired, it could put you at risk with your job or your career. And it can just have this domino effect in the wrong direction. We want to have a domino effect taking us in the right direction. So if you have any questions or comments, please leave it in the comments section below, or reach out to me on Facebook, or reach out to me at Dr. Peters at peterswellness.com. And if you've read my book, we've had a lot of sales of the book, which I love. Love to see a positive comment on Amazon. I always ask for a 5-star review. If you don't think it was worth 5 stars, don't bother. So just have an amazing week, and remember to be having the right attitude and a positive outlook, and work on making yourself better every day. Have a great week.